Welcome to Advanced Clinical Documentation for Nurses and Clinicians. We're an educational consulting and tutoring service. Please visit our website at www.acd4n.com. Again, that is www.acd4n.com. We provide educational and tutoring services for adult learners and high school students. Our services for our high school students is through our SOAR program. And we also provide services for adult learners who are either licensed or unlicensed, interested in entering the healthcare field, or already in the healthcare field and interested in advancing in the healthcare field, and they're looking for mentors. So we're also inviting mentors to reach out to us. If you are interested in mentoring someone and you need a platform or service to do that through, please send us an email at advanced nurses. Again, that is advanced nurses at acd4n.com, and the information will be left at the completion of this presentation. So if you just bear with me, we'll get to the end of this presentation and you will see that information, but we want to hear from you. So I just want to talk about this project, Culturally Competent Nursing and Evaluation Plan. Although programs and webinars discuss cultural competency, these initiatives often lack an assessment resource to determine the growth and progress of an individual. So this resource is really looking to help nurse leaders, nurse educators, and nurses, or even healthcare professionals who manage and lead nursing activities, help nurses know the ways to be aware and sensitive to the needs of individuals from marginalized communities. So we're just going to move forward. I'm going to talk a little bit about the background of this project. So back in 2016, when I was in graduate school at Sacred Heart University, I had submitted an essay called Patient Self-Management, Impact of Racism-Related Vigilance in the Management of Hypertension in African Americans. And what really made me write this paper, because we could elect, what subjects we want to talk about. I really talked about this subject because I really was focused on the subject, rather, because I was at the time a service coordinator nurse working with veterans. And one thing I noticed about the veteran population is that they had such unique and specific needs. And it made me think so much about the unique and specific needs of African Americans. And for me, taking care of veterans, I really think about the fact that a lot of them the veterans I was taking care of, a lot of them really needed my assistance and my help. However, these are people who sacrificed their life. They've made a commitment to really serving the country, and yet so little in return. And a lot of what my services was tailored to do was to really help them navigate the healthcare system. And it really made me think about the kind of sensitivity and awareness that should be extended to African Americans related to the management of chronic conditions. And the chronic condition that, of course, that I decided to talk about in my paper, or discuss in my paper rather, was hypertension. So let's look at identifying this problem. So this is what the American Public Health Association defines as racism. Racism is a system of structuring opportunity and assigning value based on social interpretations of how one looks, which is what we call race, that unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and saps the strength of the whole society through a waste of human resources. Okay, so I just borrowed that definition just for this presentation. So going back to the essay I submitted, when I was at Sacred Heart University, I was at the time, I constantly wrote about amplifying the voices of marginalized and underserved communities. And the more I discussed it, is the more I really understood why we have to have healthcare services tailored to the unique needs of individuals who are marginalized and who deal with discrimination. And a lot of this has to do with the fact that there is a lack of trust between healthcare providers and patient. That relationship really requires consistent attention, special attention, and there needs to always be an ongoing effort to address the needs of that particular relationship. Again, the clinician or the nurse and the patient. And similarly, I also think that there needs to be that same type of attention paid to uh, students from multicultural backgrounds or from diverse backgrounds, um, with their nurse educators, who are most often um, white. And 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 again, this racism related vigilance or anticipatory stress is really, it's really a mechanism that is not um, well understood, but it's been well documented and researched, but it's not well understood, because I think what happens is a lot of times people think about stress and they think about hypertension, and that makes sense together. But when people think about discrimination and they think about racism, they for some reason don't attach the stress that comes from those events. So if, for example, if you ever experience discrimination, you are constantly in a place where you're trying to modify your behavior, the way you approach things, the way you say things, so that you don't have that experience again. It's not a lovely experience. It's definitely something you want to avoid. Okay. So again, it's, even if it's perceived, there is this need to constantly monitor and modify your behavior, which can be overwhelming to anyone. But if you think about it, it's like you're almost in the fight or flight stage, or you're kind of always in that mindset or feeling like that, even in your regular everyday activities, whether it's just going to the bank, whether it's going to a restaurant. And we'll talk about that a little bit further in this presentation, so I don't want to spend too much time on that. But again, this stress response is one that requires continual activation of the biological stress response system. So racism related vigilance, this modifying of your behavior and adjusting the way you do things, it actually requires this. And research has found that this continual activation of the biological stress response leaves you kind of at a place where you're kind of always on edge if you're always dealing with this type of anxiety. And so here in this discrimination survey, which is available on the website www.acd4n.com, if you go on the website and you look under publications, you will see a tab there for the discrimination survey, and we encourage you to complete it. And essentially, as you can see by the recommended responses, the scale at the bottom is just simply saying that there are people who are at higher risk for this type of hypertension, or predisposed to this hypertension, because of the fact that they're in their daily activities, they are dealing with this adjustment and this modifying of their behavior. And as you can see by some of the survey questions, some people may look at these survey questions and completely resonate with it. Some people may look at it and think that this is something that just can't be. How is a person always doing this? Or maybe there could be a belief that everybody deals with this. And, why are we just focusing on African Americans? So we focus on African Americans because essentially the numbers and the data shows that African Americans are more at risk for developing and dying from chronic conditions, and that we in the healthcare field know for the most part is avoidable. So we have to do what we have to do on our end. So I created the Afro-cultural trauma and discrimination stress model to really depict the relationship of all of those different factors and elements. And that could be anything from, as you can see here in this model, the unpredictable environment. Now, the unpredictable environment that I am describing here in this model is really talking about the fact that if you are in a position where you are not, let's say, a part of the dominant society, and you are more often the victim of discrimination and racism, you are in a space where things are just completely out of your control. And then you have the redlining. You also have other, let's say, social codes that, even in the history of Jim Crow, you have social codes that really inform how people act and treat individuals who are in the undesirable, or who are not in the dominant society. Okay. So as you can see by the model here, you see that Afro-cultural trauma, um, compromised collective identity and negative worldview. And of course, this is happening because of the racism and the discrimination. Then you also have a lower socioeconomic status. If there's enough research that looks at that, even when we are talking about what we would consider highly educated, highly skilled individuals, they tend to still be paid lower than their white counterparts. Okay. And then also we have history of experimental medical science on African American subjects. All of that, I would recommend anyone who's interested in looking at that further to read Medical Apartheid by Harriet Washington. Very, very, very good book to read to understand the depth of that, because it goes far beyond the Tuskegee experiment and forced sterilizations. So anyway, without going too much on a tangent, you see the model there, and that the models actually included inside of this resource to help really drive the point home about the social determinants in health that really impact and direct and really help us know how some people may be at more at risk than others. So nursing education, how does nursing education play a role in this? Again, nurses make up the largest segment of the healthcare system. So nurses play a really big role, and nurses can really turn this around if we really look at our nursing curriculum and our practices in nursing education. So the American Association of College of Nursing, they develop strategies to enhance diversity in nursing education. And one of the reasons why they really focused on this, as you can see, is because they identify that there's a lack of minority nurse educators. And their concern is that this lack of minority nurse educators may lead to students believing that there is just no value shown or no value placed on diversity within the profession. Also, that there may be limitations in access to opportunities to advance in the profession. And then lastly here, it raises the concerns of a lack of academic role models, because of course, if you are a um, student of a diverse or multicultural background, you may actually feel that you have nobody that you can connect to within a leadership role. So therefore, that could really make you think to yourself, I don't know if this is a profession I want to stay in. So that's definitely something that we need to consider as nurse educators. And so this book actually looks at strategies strategies and teaching tools that can really help us with navigating this issue. So within this resource, we actually have a cultural competence self-assessment, reflective writing assignment with guided questions, curriculum questionnaire, and that questionnaire is really for the nurse educators and really for faculty to complete. Case study rubric. There's a rubric for a case study assignment. Cultural immersion experience. So there is a suggestion for a cultural immersion experience. And cultural immersion experience is really talking about having nursing students work directly and in the environment of the patients that they're serving. So in this example, I focus on African Americans, and I really promote partnership within a community, even if it's a church-based health promotion program. These are the types of programs that have worked with increasing the trust or enhancing the educational opportunities between patients and healthcare professionals. Also, a curriculum committee, a committee of faculty who will be working together to help with curriculum revision and help be a source for nurse educators and other members of faculty to really have a place to go to, a team of people to work with to help them get access to resources to enhance cultural knowledge in nursing curriculum. And then we also have a cultural competency evaluation. That is an assessment tool that is actually I'm going to have it in the presentation here to show you an example of one I did for the American Association of College of Nursing. But that's not the one exactly that's in this book, but it's the same structure for the one that's in this book. But again, the one I'm going to show is for the AACN, but you will see it later on in the presentation. There's also a curriculum evaluation plan. So a plan in place to actually evaluate the curriculum. And then an implementation plan. The implementation plan is literally looking at how do we implement this plan? And then we have a timeline of how all of that, how it all flows. Okay. And what is the goal? The goal is to establish a consensus on a faculty-wide definition of cultural competence that will be applied across all nurse educators and students' activities and evaluation tools. And so that is coming straight out of this resource. Okay. I have a copy of it right here. I'm so excited about sharing it. Okay. This is how it's going to look. And it will actually be an ebook and a print, in print version. The good thing about the print version is if you buy the print version, you get the ebook for free. And we'll be running that promotion as an early promo for the book, the resource release. But again, if you buy the book in print, you get the ebook for free. And so this is the evaluation tool that I was referring to. So let's just look at this evaluation tool. As you can see, this evaluation tool comprises of 5 competencies, a comment section for student and instructor feedback, grading scale, and you see a final evaluation of pass or fail. This is a very detailed assessment tool. This is a great way of really evaluating if students are actually performing these activities from a culturally competent and a culturally aware point of view. Now, this evaluation tool is something that we really encourage nurse instructors to use in the clinical, for clinical learning, because we understand that during clinicals, that's when we can really observe the students' behaviors with the patients. Okay, and see if they're really applying what they've been learning in the classroom, if they've really been applying the strategies that we've implemented through the curriculum revision. So this is a great way to measure the effectiveness of the curriculum altogether. So I want to thank you for taking the time to allow me to share what this resource is going to all be about. And I'm so excited about it. There will be an official promotional video about this resource, but I just wanted to do a little quick talk about it because I think it's really important to kind of open up the conversation and prepare people for discussions about this resource. And so that when people see it and they say, I wonder what that's really about, they know what it's about. And actually by watching this video, they get a pretty good idea of the background behind some of the concepts that might be addressed in the book. And of course, they can reach out to me. My website is www.acd4n.com. Again, www.acd4n.com. You can also follow us on Twitter at acd4n_LLC and email us at advancednurses, not nurse. I know that video. When you watch this video, you're going to see nurse, but it's advancednurses@acd4n.com. So we want to hear from you today. Please do not hesitate to reach out. If you are a mentor, if you're interested in being a mentor, please reach out to us because we do have adult learners who are licensed, who are clinicians, and they need mentorship from experienced clinicians, and we want to make sure that we make that connection for them. We also have high school students who are interested in entering healthcare. Right now, I am the only resource that they have, but I really want to broaden that and really bring other healthcare professionals in. So please reach out to us. Again, you can reach out to us at advancednurses@acd4n.com, or you can go to our contact page on our website at www.acd4n.com. Thank you. Bye-bye.